Thank you very much, Mr. Chairman. And let me just say again, I am deeply troubled by reports of rampant political interference in scientific decision-making at the CDC. It is unprecedented and it is unacceptable. We learned last week that despite knowing in January how serious COVID-19 was, President Trump has been working to downplay this crisis. And on Friday night, we learned that Trump political operatives in HHS communications office have been manipulating CDC's flagship publication for months to align with that messaging. Dr. Redfield, did anyone at CDC advise the president to downplay this crisis?
No.
Did you agree with the president's decision to downplay it?
I'm not going to comment on that, but no one advised the president to downplay this crisis.
Well, understanding the dangers, why have you not done more to push back on President Trump's political interference and its efforts to downplay this?
I want to make it really clear, Senator, and I appreciate your question and the opportunity that about the respect for the science at CDC and the independent integrity of the MMWR. At no time has the scientific integrity of the MMWR been compromised, and I can say that under my watch it will not be compromised.
Well, I understand the efforts to edit the CDC publication started in response to a May report that reviewed the spread of COVID-19 in the U.S. It was authored by CDC highly respected career deputy Dr. Schuchat. HHS political officials perceived this report as reflecting negatively on the president. Well, Dr. Redfield, yes or no? Did that May report, as drafted by Dr. Schuchat, adhere to the agency's strict code of scientific integrity?
Yes.
Well, the spokesperson for HHS claimed that there is a resistance unit at CDC and voiced concerns about ulterior deep state motives, and President Trump has bolstered skepticism in the agency's death toll. Do you agree with me that there is no truth to all those claims?
Absolutely, Senator, and I want to make a comment that not only is it not true, it deeply saddened me when I read those comments, because as I said in my statement, CDC is made up of thousands of dedicated men and women, highly competent. It is the premier public health agency in the world, dedicated 24/7 to use their skills to protect the American public and the world from the health issues. And it deeply saddened me that those false accusations were made by a group of really unbelievably professional people that serve this nation.
Well, I agree. And let me ask you then, what can Congress do to make sure we are hearing directly from public health officials without political interference?
Well, again, I'm going to commit, that we're going to continue to give Congress and the nation the best public health advice. We're not going to let political influence try to modulate that. As I mentioned, the MMWR, and it's another thing that has saddened me to hear on our watch, the concern that some have that the integrity of this really important publication was somehow compromised. And I just want to assure you and the other senators and the American public that the scientific integrity of the MMWR has not been compromised. It will not be compromised on my watch. And I will stand by the men and women that are the scientific experts that are there to do their job, to express what they know in a way that can be interpreted to the American public.
Well, I hear you, but I do think Congress needs to make clear that there's no political interference there. I will be pursuing that. Admiral Giroir, on the same issue, you are among HHS's top health officials. What are you doing to protect scientific integrity of the work done by the scientists and public health experts at CDC, Persa, and NIH from political interference?
part of my job as the senior scientific advisor to the secretary is to make sure that he gets the best science and the best evidence base that's unfiltered. I do that every single day. I work with Bob Redfield. I work with Bob Kadlec. Francis Collins and I are on speed dials. Tom Engel's very, very important with HRSA. So you have my commitment, as you always have, Senator, that I will provide the best advice to the decision makers that will be based on science and evidence, and that's the way we're going to operate going forward.
Can you right now reject the unfounded, harmful conspiracy theory that career professional leadership of CDC or any of our public health agencies have, quote, deep state ulterior motives that compromise their ability to act in the best interest of public health, as other Trump political appointees have claimed? Can you reject that, yes or no?
I have not seen anything out of CDC, HRSA, any of the agencies I work with that is anything but people acting in the best interest of the American people. I've certainly not seen anything that you described.
Thank you, Senator Murray. Senator